Welcome and very good evening, dear doctors. Today we are going to discuss on some interesting topic on medicine from the previous year questions. And today we are discussing on the acute ischemic stroke and its management, specifically about the thrombolysis. Okay, so let's start our session. What is the window period for thrombolysis in case of stroke? Options are option A 1.5 hours, option B 2.5 hours, option C 3.5 hours, and option D 4.5 hours. So the correct option is option D, that is the 4.5 hours. As you all know that patient, when you are dealing with a patient with stroke, it's actually very difficult to differentiate between the hemorrhagic stroke and the ischemic stroke on the basis of the clinical symptoms. Actually, there is no reliable sign to differentiate between them. Still, some points that actually in favors of the hemorrhagic stroke are more depressed level of consciousness, elevated blood pressure, and the rapid worsening of the symptoms. On the contrary, in case of ischemic stroke, usually patient is experiencing the maximal level of neurological deficit at the first place. Okay. So the diagnostic evaluation for the stroke, whether it is ischemic or hemorrhagic, is the CT scan or MRI. In non-contrast CT, you can see that the patient with ischemic stroke usually presents with normal to hypodense lesion, and in case of hemorrhagic stroke, it is the hyperdense lesion with or without midline shift. Now, when we are going to discuss the thrombolysis within the window period, the standard window period for intravenous thrombolysis with recombinant tissue plasminogen activator or RTPA in acute ischemic stroke is up to 4.5 hours from the symptom of onset. As you all know that the cerebral blood flow of the normal brain is around 50 to 60 ml per 100 gram of brain tissue per minute, and actually it varies globally. That is, in case of gray matter, it's around 70 to 80 ml per 100 gram of brain tissue per minute, and in case of white matter, it's around 20 to 30 ml per 100 gram of brain tissue per minute. And when the CBF comes to 0, there is death of the brain tissue, that is the cellular bodies, actions, dendrites, and the glial cells. And when the CBF is less than is equal to 16 to 18 ml per 100 gram of brain tissue per minute, infarction ensues if the blood flow, such type of blood flow, persists around 1 hour. And if the blood flow or CBF is less than 20 ml, then ischemia, cerebral ischemia ensues over hours or days. So here is two catch point. Number one, the transient ischemic attack. What does it mean? It means the cerebral tissue experience ischemia, but the blood flow has been restored in a stipulated time period. In such case, the clinical syndrome that is classified as the transient ischemic attack. And another interesting thing, that is the ischemic penumbra. What is ischemic penumbra? It is the area of the brain which is where the area which is ischemic but reversibly dysfunctional, and this area is around the this is the area that is surrounded by the core area of infarction, and this is the area that is the gold standard point for the revascularization. Yes, treating the ischemic penumbra is the actual goal of the thrombolysis. As you all know, we can image the ischemic penumbra by perfusion imaging of CT or MRI. So now come to the point, the key guidelines. In 0 to 3 hours is approved for the all eligible patient. This is the thrombolysis window period, and in case of in 3 to 5 hours, this is the that extends the window as per the ECAS 3 trial with stricter exclusion criteria. What are those? That is the age more than 80, severe stroke, anticoagulant use, and the diabetes with prior stroke. These are the key guidelines for the thrombolysis window period. And here is the concept of time is brain. What is that? Although the window period, the window extends to 4.5 hours, earlier treatment yields significantly better outcome. The NNT, that is the number needed to treat to achieve then excellent outcome, increase as the time passes. NNT of 4 to 5 if treated within 90 minutes. NNT 9 if treated within 3 hours, and NNT 14 if patient treated between the 3 to 4.5 hours. So, a patient with acute ischemic stroke, what are the standards of care? The first one is the medical support. Right? First, when you encounter a patient with acute ischemic stroke, start with ABC, airway, breathing and circulation. Check the blood pressure, check the blood sugar. Both hypoglycemia and hyperglycemia are deleterious in such patient. And our blood pressure is more than 185 by 110, it should be treated if patient is undergoing for the thrombolysis as candidate. Next thing, that is the thrombolysis. We have just already discussed about the window period of the thrombolysis, and the agent we are using usually, that is the RTPA, recombinant tissue plasminogen activator, the form of alteplase or tenecteplase. Tenecteplase actually having the quick onset and of action, and you can give it within a very short time. So the patient, those who are undergoing the endovascular treatment, they are the typical candidates for the tenecteplase over alteplase. Now, next part is the endovascular therapy. After the medical thrombolysis, in the endovascular therapy. What is this? For the large vessel occlusion, here the window period can be changed up to 24 hours. And large vessel like the middle cerebral artery or the internal part of the internal carotid artery, the mechanical thrombectomy is the standard of care with an extended window period up to 24 hours in a selected patient as per the Dawn and the diffuse 3 criteria. Another part of the standard care, there is the antithrombotic therapy, neuroprotection, and the rehabilitation. So, we should also know some related points That is the absolute contraindication of the thrombolysis. What are those? Recent head trauma or prior stroke or last 3 months. Symptoms of subarachnoid hemorrhage. Anterior puncture of the arterial puncture of the non-compressible site for last 7 days. Elevated blood pressure more than 185 by 110 millimeter of Hg and active internal bleeding. Those are the absolute contraindication of those thrombolysis. Another special point you should know about the acute ischemic stroke, the treatment of the blood pressure. Is it required? Yes. The answer is you have to treat blood pressure as per the or case to case basis. Means if the patient is, if the blood pressure is more than 220 by 120 millimeter of mercury, you should treat. If there is a feature of the malignant, there are symptoms and signs of malignant hypertension, you should treat. If patient is experiencing the myocardial ischemia, you should treat the blood pressure. So all those are the points for treatment of the blood. Another interesting part, there is a patient with blood pressure more than 185 by 110 and has been selected as a candidate of the thrombolysis. It's better to treat the blood pressure below 185 by 110 for successful thrombolysis. So this is all about the today's discussion. Welcome to AiMedTech. Myself, Dr. Ratul Basu. We are coming with more interesting topic in future. Stay strategic, stay focused. See you soon.